Measles was declared eliminated in Canada in 1998. So why are so many people getting sick now?
It is so darn contagious. Like, it is the textbook worst in terms of transmissibility to others.
Measles can spread through the air and can initially cause a fever, cough, red eyes, runny nose, and sometimes even white spots in the mouth. Later, a distinctive red rash can develop. Most of the cases in Canada in the fall were linked to international travelers. Outbreaks around the world appear to be rising.
And then, of course, our pool of people who are susceptible due to not being immunized or being under-immunized is also growing. And really, no place has gotten back to the pre-pandemic level of immunization, because the pandemic really took a lot of resources away and also probably increased some anti-vaccine sentiment in some places.
Because measles is so contagious, doctors say that you really need 95% of people in a community to be vaccinated or to have immunity in order to stop the spread. The measles, mumps, rubella, or MMR vaccine has 2 doses, typically given around 12 months of age, and again between 4 and 6 years old. The Public Health Agency of Canada says rates for both doses are dropping. There are also some millennial and Gen Xers who may have only received 1 dose.
There's always a bit of complacency when we haven't seen impacts of a disease, and we feel that we don't necessarily have to worry about it. I think that's no longer the case, certainly in our region.
There have been more than 500 cases of measles in Canada so far this year, the vast majority in Ontario. Compare that to all of last year, when the federal government reported 147 cases. And although the disease was declared eliminated in Canada, we've seen occasional spikes like this before.
Although most of our cases are able to recover at home, some do need to seek medical attention and to be admitted to hospitals.
There can also be some really serious complications with measles, like pneumonia, brain swelling, even death. And because it can take about 10 days for common symptoms to appear, exposure can happen anywhere, from doctors' offices to restaurants and airports.
Honestly, it's really frustrating.
Marissa Latton's son has cystic fibrosis and is immunocompromised. He was exposed to 2 confirmed cases of measles at a doctor's appointment. He's only 7 months old and hadn't yet received the first dose of the MMR vaccine.
To have to be weary now about dormant diseases, that's just ludicrous. I shouldn't have to worry about things like that, all because of the choices of others.
So, can Canada really say that measles has been eliminated? If local transmission occurs for a year, we're going to risk losing that status.